Stroke can occur when the blood supply to your brain is interrupted or reduced. It is important to recognize the symptoms very quickly because immediate medical care is needed, as they can cause long-term disability, brain damage, and even death. However, many people do not realize that they are having a stroke, as the symptoms can often be subtle or easily overlooked. In this video, we will discuss 9 key symptoms of stroke that should never be ignored. Recognizing these warning symptoms can help you or your loved ones take immediate action. So, stick around till the end to find out what these crucial symptoms are and how they can help you identify a stroke before it's too late. Number 1. Sudden severe headache. One of the most common symptoms of a stroke is a sudden severe headache. Unlike regular headaches, a stroke-induced headache can be excruciating and develop rapidly. It may feel as if someone has hit you on the head or that your head is about to explode. This intense headache occurs when a blood vessel in the brain bursts or starts bleeding, leading to increased pressure within the skull. The sudden onset and severity of the headache are key indicators that require immediate medical attention. Number 2. Sudden numbness or weakness. Another significant symptom of a stroke is sudden numbness or weakness, usually on one side of the body. This phenomenon is called hemiparesis and can manifest as a sudden loss of sensation or a feeling of weakness in the face, arm, or leg. For example, you may suddenly notice that one side of your face droops when you smile, or that you have difficulty lifting one arm or leg. These signs occur because a stroke disrupts the flow of blood and oxygen to specific areas of the brain that control movement and sensation. The affected side of the body may feel heavy or unresponsive, making simple tasks such as picking up objects or maintaining balance difficult. It is crucial to seek immediate medical attention if you or someone you know experiences sudden numbness or weakness, especially if it is on one side of the body. Delayed treatment can lead to permanent impairment or disability. Number 3. Trouble speaking or understanding. Difficulty speaking or understanding others is another significant symptom of a stroke. It may manifest as slurred speech, garbled words, or an inability to find the right words. Likewise, understanding others' speech may become challenging. This symptom occurs because a stroke affects the part of the brain responsible for language processing. The disruption in blood flow to this area impairs communication abilities. When you experience trouble speaking, you may notice that your words don't come out clearly, and your speech may sound slurred or mumbled. Additionally, you may struggle to understand what others are saying. Simple tasks such as naming objects or following conversations may become difficult. Before we proceed to the next alarming symptom, be sure to hit the subscribe button. Number 4. Vision problems. Vision problems can also be a warning sign of a stroke. Sudden blurred or double vision or a loss of vision in one or both eyes are symptoms that should not be ignored. A stroke can affect the blood vessels or optic nerve responsible for vision, leading to these visual disturbances. You may experience a sudden onset or blurred or distorted vision, making it difficult to read or recognize objects. Additionally, you may notice a partial or complete loss of vision in one or both eyes, often described as a curtain or veil obstructing the visual field. These visual changes occur due to the interruption of blood flow to the visual processing areas of the brain. If you experience sudden changes in your vision, seek immediate medical attention to rule out a stroke or other serious eye conditions. It is essential to note that not all vision problems are caused by strokes, as they can also be related to migraines, glaucoma, or other eye conditions. Proper diagnosis is crucial to determine the underlying cause and provide appropriate treatment. Number 5. Trouble walking or loss of balance. Another symptom of a stroke is difficulty walking or a sudden loss of balance. You may feel unsteady on your feet, have trouble coordinating movements, or even experience a complete loss of balance. This symptom, known as ataxia, occurs when a stroke interferes with the brain's control over motor function and coordination. The disruption in blood flow to the brain's motor areas affects the signals that coordinate muscle movement, leading to difficulties in walking and maintaining balance. You may find it challenging to take normal steps, stumbling or veering to one side while walking. In other cases, a loss of balance can result in falls. Physical therapy may be recommended as part of the rehabilitation process to regain mobility and improve balance. Number 6. Sudden confusion or trouble understanding. A stroke can cause sudden confusion, disorientation, and difficulty understanding what is happening around you. You may find it difficult to comprehend spoken or written language, follow directions, or make decisions. This cognitive impairment is a result of the brain's blood flow disruption affecting regions responsible for cognitive function and information processing. Sudden confusion or trouble understanding can be distressing and may necessitate immediate medical attention. Simple tasks such as understanding conversations, identifying familiar objects, or following instructions may become difficult. You may feel disoriented, have difficulty maintaining attention, or experience memory lapses. It is crucial to seek prompt medical evaluation to determine the cause of the cognitive impairment and implement appropriate management strategies. Rehabilitation programs, including cognitive therapy and memory exercises, may be recommended to help in recovery and restore cognitive abilities. Number 7. Trouble swallowing. Difficulty swallowing, known as dysphagia, is another symptom that should never be ignored, as it could also indicate a stroke. You may have trouble moving food or liquid from your mouth to your stomach, feel as if something is stuck in your throat, or experience pain while swallowing. A stroke disrupts the blood flow to the part of the brain responsible for controlling the swallowing reflex, leading to dysphagia. Swallowing difficulties can range from mild discomfort to severe impairment. You may experience choking episodes, frequent coughing, or throat clearing while eating or drinking, or you may even have difficulty speaking clearly. Dysphagia can not only cause discomfort, but also increase the risk of aspiration pneumonia or dehydration. If you experience any of these symptoms, it is important to seek immediate medical attention for proper evaluation and management. A speech therapist may be involved in your care to provide swallowing exercises or recommend dietary changes to help improve swallowing function. Number 8. Sudden behavioral changes. Behavioral changes can occur as a result of a stroke, affecting a person's mood, personality, and emotional state. These changes can manifest as sudden shifts in behavior, mood swings, aggression, apathy, or depression. The disruption of blood flow to specific brain regions responsible for regulating emotions and behavior can lead to these alterations. Family members or close friends may notice that the individual's personality seems to have changed, with uncharacteristic outbursts or withdrawal. It is crucial to recognize that behavioral challenges alone may not necessarily indicate a stroke, but should prompt further investigation and medical evaluation. Number 9. Sudden memory loss. Memory loss, particularly the sudden inability to recall recent events or important details, can be another possible symptom of a stroke. This type of memory loss is commonly referred to as transient global amnesia. During an episode of transient global amnesia, individuals may have difficulty retaining new information, forming new memories, or recalling recent events. They may repeatedly ask the same questions or appear disoriented. This temporary memory disruption occurs due to a transient interruption of blood flow to the hippocampus, a vital brain region involved in memory formation and retrieval. It is essential to seek immediate medical attention if you or someone you know experiences sudden memory loss, as it can be indicative of an underlying health issue like a stroke or a transient ischemic attack, TIA. Prompt evaluation by a healthcare professional is crucial for proper diagnosis and appropriate management. Thank you for watching, and make sure to watch more amazing videos from our channel.